Kawempe National Referral Hospital receives 8 to 25 mothers every day to unsafe abortion. And the countrywide picture indicates that every year Uganda loses 1,500 mothers to unsafe abortion, according to a 2016 report by Reproductive Health Rights Organization. Available information from Guchama Institute also indicates that Uganda used a minimum of 7.5 billion Uganda shillings in 2016 to treat registered cases of unsafe abortion. This means that the reality picture could be worse when you consider that many patients of this nature may prefer private treatment. Unsafe abortion refers to the termination of a pregnancy by unskilled personnel or in an environment that makes it dangerous for the patient. Sometimes the women self-administer dangerous substances to terminate an unwanted pregnancy.
It is done by someone who is not fully trained. It is done by someone who is not skilled. You may have the training, but you may lack the skill for that particular procedure. It is done in the wrong environment, using possibly drugs and instruments that are not properly prepared. And ultimately, and most of the time, they result in complications. Find some people using quinine, for instance, because they know sometimes when you use quinine when you are pregnant, the pregnancy comes out. So they try to use quinine on themselves.
Put a lot of medicines, tablets in a cup of water, and they take these, and assuming that in 24 hours they will see some degree of what? This pregnancy terminating. So practically trying to push things into the vagina, thinking that they're actually aiming at the uterus and they're ending that pregnancy. Using wrong equipment, unsteady equipment, probably rudimentary equipment.
According to a 2016 Uganda Demographic Health Survey, 4 to 6 maternal deaths out of the 16 mothers that die every day is related to unsafe abortion. The probability of whether the person in danger may survive or not sometimes depends on how soon they get to the emergency ward, but even then, this may not be assured since some of the medics may have reservations on offering treatment.
Treating that patient to full recovery, which may sometimes even involve theater operations and long periods of antibiotics, fluids and so on, becomes very expensive, and it puts a burden on the healthcare system.
Okay, sometimes it doesn't come in time. The blood that we need the blood within 24 hours. Some of these little girls, but sometimes, unfortunately, some of these very terrible damages may end a life.
A mother comes when she has started already bleeding, came with the use of lower abdominal pain and backache, and the bleeding is too much. And the way has already started opening. I mean, the cervix has already started open, so the baby cannot be what? Cannot be safe.
Dr. Kayongo reveals that the conflicting interpretation of provisions of the Constitution, Penal Code Act and National Policy Guidelines, and service standards which do not clearly state the circumstances under which abortion is permitted, have created uncertainty among the different stakeholders, including the women, healthcare providers, law enforcers, judiciary, legislators, and others.
It is restrictive in such a sense that it largely bars or outlaws or makes abortion illegal, largely, but only allows it for a few small instances where it should be done to save a mother's life. Now, in healthcare practice, those situations to save a mother's life are really few. Some may be like when a mother has a bad type of high blood pressure while pregnant.
That is not envisaged under the law. It also talks about the fact that it be done by a qualified person. Now, it never defines who a qualified person is, but also does not tell us under what circumstances may, for instance, a mother's life be threatened. So the law may not spell that out. Usually we wait for standards and guidelines which spell that out.
Advocates for safe reproductive health space advise that closing gaps for access, availability and affordability will heavily reduce on the losses, be it in lives, financial and otherwise.
As a result of that, the government is investing but it's not investing sufficiently. But I also think it's not investing wisely. Because if you actually invested much more in the prevention and the termination of pregnancy, you would reduce the 800 terminations of pregnancies which are happening, and many of which are actually unsafe and resulting into health dangers.
A clear legal and policy framework, proper guidelines, of course, and of providing adequate medicines and sundries for women with post-abortion complications. That's also important, because it's not enough to assume that when they come for post-abortion care, actually there are enough drugs and sundries to take care of them. Sometimes that is not the case.
Religious leaders, we've brought on the civil society organizations to try and help propagate the information to the masses.
Usually, unsafe abortions are also a result of stigma, religious, cultural, myths about modern family planning, lack of sensitization, and to this, the experts think that fast-tracking the school's sexuality education framework will guide on age-appropriate materials that may be fundamental in making sure no more deaths related to unsafe abortion.
We cannot continue judging women that are dying because of unsafe abortions when the system has not been supportive. We can no longer bury our heads and pretend that it is not happening. I think as part of the legal reform process, the government needs to undertake a community assessment, an assessment that is not just in Parliament. But we have seen that in many years, people spend a lot of time criminalizing some actions. But
the unregulated mushrooming clinics are a breeding ground for unsafe abortion. Overall, it's government's responsibility to secure the health of its citizens, and the private sector only comes in handy to support the cause. Therefore, even intentional improved budget specific to reproductive health is another area that should be given a priority. Overall, the recommendations include government being at the forefront of spearheading information dissemination, of avoiding unwanted pregnancies, publicize the current version of the National Policy Guidelines and Service Standards for Sexual and Reproductive Health Rights, address the stigma, discrimination and silence that force women and girls to resort to unsafe abortions, provide sensitization training to healthcare staff so that women with abortion-related complications know that they can get the necessary medical care without fear of hostility. Ensure adequate access to family planning information and sufficient consistent supplies of a full range of contraceptive methods to avoid stockouts. Also ensure that social cultural norms that result in barriers to access, such as practices of requiring spousal authorization or being married as a precondition for access to contraception, is also handled. Embark on nationwide information and educational campaigns aimed at both men and women to provide accurate evidence-based information about contraception. And then improve access to comprehensive age-appropriate sexuality education as a measure. For UBC News, I am Rose Pichirwa.